Okay, and the topic of the last speech is the plant-based diet and the healthy aging, the Tzu Chi Health Study, which delivered by the Tina Xueting. Tina now is the associate investigator at the National Center of Geriatric and Welfare Research, National Health Research Institute, since 2024. Is right? I think maybe early. Okay, yeah, and he got his PhD from the National Taiwan University at the Institute of Epidemiology and Preventive Medicine. And Tina also is a dietetics and got this position from the University of Bristol, Columbia, Canada. And he also served previous position about association professor in Department of Nutrition Science in Furen Catholic University, Taiwan. And his major research institute is plant-based diet and healthy aging. Let's give the big hand for the Tina.
Thank you, Mr. Chairman, and thank you everyone for staying until the very end of the talk. So before we finish, I would like to take you to discover a population that in my heart is really a treasure in Taiwan. My talk today entitled Plant-Based Diet and Healthy Aging. And many of you are probably very skeptical about this diet. You will be thinking that, oh, healthy aging, don't you need more protein? Are you going to be protein deficient? Are you going to be omega-3 deficient? How would they feel? Well, I feel the same way. I was curious about how people who follow a plant-based diet, how is it going to contribute to their health outcome, especially the ones related to aging. And so we established a cohort to examine this. This is my outline today. I will briefly introduce the Tzu Chi cohorts that we established. We will go over some of the outcomes that are relevant to healthy aging, including diabetes, stroke, gout, cataract, insomnia, and finally dementia. And also medical expenditures afterwards. And finally, I will give a summary and implication about our study. So the Tzu Chi cohort study, many of you probably know that Tzu Chi is a charity foundation. Indeed, many would have considered Master Zheng Yan one of the most important religious leaders in Taiwan who established Tzu Chi Foundation more than 50 years ago with 30 housewives. It was a humble beginning on the poor east coast of Taiwan called the Back Mountain. Tzu means compassion and Ji means relief. Fundamentally, Tzu Chi differ from other Buddhist organizations in that it really focuses on Buddhism in action. So back to its founding, Master led her disciples to visit the poor and try to help them in every way they could. They didn't have a lot of resource. But after many years of helping the poor, she discovered that one of the major root causes to poverty is actually falling into sickness. And so she wanted to do something. But in Hualien, there's very little medical resource. So she invited doctors from National Taiwan University in Taipei to come to Hualien twice a week for 15 years to hold free clinics for the poor before establishing the first large hospital in Hualien in Taiwan. But then after the hospital was built, very few people wanted to come. There's a difficulty recruiting physicians and nurses, and that is why they started building medical and nursing schools, expanding the field to education. Long story short, after a few decades, it has its mission in many areas, including humanistic culture, international relief, bone marrow donation, community volunteerism, and environmental protection, impacting not only Taiwan, but the whole world communities. Well, from 30 housewives to the largest charity organization in Taiwan, along this path, it has inspired hundreds of thousands of volunteers who volunteer their lives and in the process become transformed. To become a Tzu Chi volunteer, one has to have at least 2 years of internship. And it's not just 2 years, it's actually a lifelong commitment. It's a highly disciplined process. Volunteers actually had to quit smoking and alcohol in the process. And they were encouraged to adopt a vegetarian diet. It's not required, but it's highly encouraged. So here you have a group of people, in fact, hundreds of thousands of individuals who devote their times and lives to various amount of volunteer work, local, either it's charity, international disaster relief, recycling, or doing some work in a hospital. Wherever disasters are, you can find Tzu Chi volunteers. And along the process, they cultivate spirituality and compassion. Along with healthy lifestyle, and at the time when we conducted a study, about 30% of the volunteers were vegetarians, while 2/3 of them were not vegetarians. So here we have a group of people who have a similar lifestyle, devotion to religion and community volunteer work, but they differ in their diet. So our team established 2 cohorts. The Tzu Chi vegetarian study that was established in 2005 with about 12,000 people in the study, but it's a large community-based study with only a self-administered questionnaire on demographics, medical history, lifestyle, and diet. After conducting this study, we thought, this is really not enough because it's one questionnaire. So our team devoted to a new study shortly afterwards from 2007 to 2009 in Dalian Tzu Chi Hospital. We recruited about 6,000 Tzu Chi volunteers, or mostly Tzu Chi volunteers or their family. Besides the questionnaire that are administered by trained interviewers, we also had comprehensive health examinations for everyone. In terms of follow-up, both cohorts are linked to the National Health Insurance Database and the Death Registry. The NHI covers nearly 100% of the Taiwanese population. It contains medical claim records, diagnosis, medication prescription, as well as medical procedures, surgical procedures. In addition, cohort 1, the Tzu Chi Health Study, every 3 years, participants were invited to come back for follow-up health examinations and to fill out a simple questionnaire on disease diagnosis, diet, and lifestyles. So after 2 rounds of follow-ups, that's about 6 years, the follow-up rate is 93%. Diet was assessed through a questionnaire that had been validated within the population with moderate to high validity for major nutrients and food groups. And we found that vegetarians in this population, compared with non-vegetarians, had higher intake of soy, vegetables, whole grains, similar intake of dairy and fruits, and in terms of nutrients, higher carbohydrate, fiber, calcium, magnesium, total and non-heme iron, folate, and vitamin A, while lower in saturated fat, cholesterol, and vitamin B12. And the cross-sectional analyses also show that they have a lower prevalence of diabetes and fasting impaired glucose fasting. So it's when you think about vegetarian diets, most of the evidence are from the Western population, most notably the Adventist Health Study 2 and EPIC Oxford. So Tzu Chi cohort is actually very important in terms of examining Asian vegetarian diet. So together with these other groups, we published a review paper in Advances in Nutrition discussing about vegetarian epidemiology. And afterwards, we joined a consortium initiated by the University of Oxford with 11 prospective cohort studies, including several cohorts with high proportions of vegetarians, but also several very large cohorts. So here are the cross-sectional analysis of dietary intake. This is the red and processed meat intake, and compared with other cohort, the red and processed meat intake in our population is relatively low, second only to Adventist health studies. While our group had the highest vegetable intakes, especially among vegetarians, but the fruit intake is not so high, it's in the middle. In terms of BMI, we can see here, Tzu Chi population, there seems to be some similarity in our study with other Western populations in that vegans tend to have the lowest BMI, followed by vegetarians, and then pesco or polio, those vegetarian, not vegetarian, but those who are eating white meat, poultry. While meat eaters, generally the non-vegetarians have the highest BMI. This is quite different from some of the Asian populations, especially in the China Kadoorie Biobank or the Indian study, CARS-1 and CARS-2, where vegetarians may not necessarily have any advantage in terms of BMI. Over the past 10 years, we published many outcomes, but today I will, due to limited time, I will present outcomes that are most relevant to healthy aging. So first of all, I think diabetes is a very important disease that we need to prevent because it's contributing to dementia and other important outcomes. And notably, diabetes is also relevant to sarcopenia in that they both have the mechanism of higher intracellular lipid. Higher intracellular lipids not only contribute to sarcopenic obesity, lower grip strength, sarcopenia, but it actually also increase insulin resistance. From our study, we found that vegetarians have lower risk of diabetes. And over the process of tracking their diet, we also discovered that some people, small percentage of people who convert from vegetarians to non-vegetarians also experience similar lower risk of diabetes. Another question I get asked a lot is that if people adopt vegetarian diet and they'll tend to eat more soy, would they get higher uric acid and more gout? So I was very interested in the topic, and we looked into the uric acid level, and we found that lacto-ovo vegetarian actually had the lowest uric acid, followed by vegans and then non-vegetarians. This is different from the EPIC Oxford finding, where lacto-ovo also had the lowest uric acid, but vegan had the highest. And I think maybe that is because vegan in the study, they don't consume any dairy. But the dairy consumption is low in all of our groups, and dairy is known to be uric acid lowering. So we follow this participant up for over 6 and about 10 years, and by linking to the National Health Research database, the National Health Insurance database, and we found that there was a lower risk of developing gout in vegetarians compared with non-vegetarians in both of our cohorts. And interestingly, for one of our cohorts with health examination, even after adjustment for hyperuricemia, we still see a significant protection, suggesting that the effect may not be through uric acid alone, and perhaps it may be relevant to inflammation. But of course, we need more studies to understand that pathway. Another very important outcome is stroke, cardiovascular disease. And particularly, a lot of people would have questions because vegetarians tend to be lower in vitamin B12 that may raise homocysteine. So we were very interested in checking out to see whether vegetarians in this population have a higher risk for stroke. And we examined different types of stroke, including total stroke, ischemic stroke, and hemorrhagic stroke. And interestingly, we found that there was a strong protective association between vegetarian diet and overall stroke and ischemic stroke in both cohorts. For hemorrhagic stroke, there wasn't any case in cohort 1 in vegetarians, so we couldn't analyze the data. But in cohort 2, that is larger, we found that there was also a marginal protective association, though not statistically significant. Our finding is actually different from the EPIC Oxford, where they found that while for ischemic heart disease and ischemic stroke, vegetarian diet seems to be good, but they found that vegetarian diet was associated with higher hemorrhagic stroke. This is different from our finding. And we speculate that one of the reasons may be the alcohol consumption was a lot higher in the British population, especially among vegans and vegetarians. And there's been studies suggesting that alcohol may potentially modify the effect of cholesterol on hemorrhagic stroke. But again, we probably need more study to double check on that. I think one of the possible protective mechanisms is that vegetarians in our study tend to have lower blood pressure, lower hypertension, and lower cholesterol. And we know that hypertension is the most important modifiable risk factor attributing to a high percentage, accounting for a high percentage of population attributable risk for both ischemic and hemorrhagic stroke. Studies also suggested that when you treat those with high cholesterol with statin to lower them, lowering of LDL cholesterol can also lead to reduction in stroke as well. Now, another interesting topic we look into is cataract, and that might be relevant to aging because as we age, we tend to lose our eyesight, and cataract is a very important public health problem in countries that do not have medical access to cataract surgery. So we looked into our population and found that there was a protective association with vegetarian diet and the development of cataract among those aged 40 and above. And particularly if they are overweight, the protective association seems to be stronger. And another topic that we are very interested in is insomnia. We know that having good quality of sleep is extremely important to healthy aging, to mental health, to a lot of diseases, including ischemic stroke. So we look into not just vegetarian diet, but plant-based dietary patterns and risk of insomnia. And then we found that those people, vegetarians, actually have lower risk of insomnia in both male and female, but the association seems to be stronger among male. Now, we also try to examine the so-called healthy plant-based diet developed by the Harvard group, but we found that there was a protective association in male group, but there doesn't seem to be any protection in female. And again, not just in insomnia, we look into different diseases, trying to analyze the so-called healthy plant-based diet. I was expecting that the healthy plant-based diet would be even more protective than just vegetarian. But somehow for all the analyses, diabetes, gout, we don't see a strong association. Sometimes it's not as significant as vegetarian diet. And my speculation is that probably the FFQ is not very accurate. Most people cannot remember exactly how much fruits, vegetable, all the foods they eat. But recalling of whether you are a vegetarian is very accurate. They know right away. So probably in the assessment of diet, knowing that they avoid meat, it's something you can ascertain very accurately. But the details of nutrient is difficult. I think that just goes to show that it's very important to develop better assessment tools for diet. Finally, I want to show a very interesting preliminary finding on dementia. I think this will be very interesting for this population. However, this is only done in Tzu Chi vegetarian study because for Tzu Chi health study, we did not have enough cases in dementia to do the analysis. So we conducted only in Tzu Chi vegetarian study. And I wanted to be very careful about this because this is based on self-administered questionnaire. We did not even have BMI measured. So this data, this finding is not adjusted for BMI, which I think is very important. We can see here, compare with non-vegetarians, vegetarians have a lower prevalence that is before follow-up. Lower prevalence for diabetes, for hyperthyroidism, cerebral vascular disease, also some of the conditions, especially in not depressive order, cardiac arrhythmia. But some of these conditions are not statistically significant. So we linked this to the National Health Insurance database and try to adjust it for some comorbidities and found that vegetarian diet was associated with reduction in risk of dementia. And as we can see here in the survival curve, there is a difference. However, the protective association seemed to be seen in the younger old. So after passing age 75, there was no protective association found in the study. So the protection seems to continue until 75 years old, but afterwards it attenuated. Finally, after looking into so many diseases and conditions, and since it's linked to the National Health Insurance database, we try to analyze the medical cost, the medical burden from the database. And we actually did a match cohort study because in this population, vegetarians were older than non-vegetarians. And age has such an important impact on medical costs that it's very important to control for it. So we did a match cohort matching on sex and age, and then compared the medical expenditure and found that vegetarian diet was associated with about 17% total medical expenditure, mostly attributable to outpatient expenditure. We also see some potential lowering of inpatient, but there was no statistical significance, most likely due to the overall health of the population that hospitalization was quite rare, and there was no difference in expenditures related to dental care. And when we look more into how these medical expenditures were incurred, we found that lower medical expenditure was found in treatment for hypertension and dyslipidemia, and interestingly, also depression. So to summarize, we found that in Taiwan, a vegetarian diet that is higher in vegetables, whole grains, soy, nuts and seeds, beans, with no meat and fish, and higher intake of fiber, magnesium, calcium, and lower saturated fat, cholesterol, and heme iron. This was associated with lower cardiometabolic risk factors, including glucose, cholesterol, uric acid, obesity, and blood pressure. And this may actually also be more antioxidative and anti-inflammatory. And prospectively, this was associated with a lower risk for diabetes, gout, total and ischemic stroke, cataract, insomnia, and dementia, and had an overall reduced healthcare burden and medical expenditure. The strength of the study was the excellent follow-up, the unique dietary pattern, and less confounding by alcohol, tobacco, and religion. Also, with detailed health examinations, we were able to examine some of the potential interactions by health status at baseline. The limitation include relatively small sample size that we may not be able to look into the rare diseases. And also for the follow-up, it's difficult to obtain a comprehensive dietary assessment. Dietary assessment is always a challenge, but something we would like to work on more in the future. But if you ask me why vegetarian diet has such a big effect, is it really true? I mean, deep in my heart, I still have question too. I think this is the question in my heart. I think vegetarians in this population may potentially be more devoted than non-vegetarian volunteers. And we know that active volunteerism can instill a sense of purpose in your life. And if you feel more purposeful, you go out more, you interact with more people, you have you have more social support. Everything could potentially contribute to healthy aging and maintenance of functions. And often, through the process of volunteering, we learn something. One master would say, 见苦知福. In seeing others suffering, you feel a deep sense of gratitude toward life. And perhaps it's the feeling of gratitude that really has a big impact on your health. And because of seeing others suffering, you see the responsibility in yourself to go out and help others. You see there's a problem, your problem as less of a problem because you see others who may need you more. So I think we must not, overall, through the lessons, I'm also a volunteer myself. Over the years, I learned that we must not think of ourselves as the one who's lending the helping hand. When we go out and help others, in a way, in Tzu Ji, what I learned is that we should actually be grateful as we learn from the life lessons of the less fortunate. Now, for my goal, I want to study plant-based diet. But deep within, I think it's not just plant-based diet. Plant-based diet is connected to so many aspects of life. It's connected to compassion and altruism, especially in this population. In this population, more volunteer work is also associated with an active lifestyle. And so in the future, I think it's not enough to just focus on diet. It's important that we look at different aspects. We want an active lifestyle. But more importantly, it's not just the physical aspect. We want to focus on the mental aspect. For Tzu Ji volunteers, it's about discovering their ikigai and the purpose to live on and the mission in their life. And every day when they go out and volunteer, they are living the mission of their life. And with such purpose in mind, you have the drive to live on. And so in order to create a sustainable communities for the aging world, I think we need a comprehensive solution incorporating many aspects and requiring all of your input regardless of your expertise at the moment. Let us work together to make this world a better place. I would like to acknowledge my colleagues from Tzu Ji, Dr. Jinlong Lin, Dr. Mingnan Lin, and some of our research assistants. Thank you very much, and I hope in the future you will have a chance to visit my beautiful country, especially the mountains.
Thank you, Tina's very excellent speech. How? And I will invite our four speakers come up to the floor, and then now we are carry out our Q&A section. Since our four presenters are well time controller, so we can allow some questions from the floor. Okay. Any question raised, please present who you are and which presenter you want to ask. Okay. Any question from the floor?
Thank you very much for your Thank you very much for your presentations. It was very intriguing, actually. I have questions for all of you, but I'll just start with one, perhaps. So Dr. Wu, actually, it was interesting to see that physical functioning actually seemed to be best at a pre-diabetes state of 6 to 6.4 for hemoglobin A1C. Can you hypothesize as to why that would be? So some of your figures showed actually a better function at hemoglobin A1C is 6 to 6.4.
Actually, it is, we hypothesize, we speculate that the lower, we observe that it's a lower HbA1c associated with worse, poor physical functioning. So in that investigation, we look out at our, pay our attention on the lower spectrum. And it is still unclear why the higher HbA1c levels have better function. Maybe because they are less malnutrition, their nutrition is better, or maybe other things. We still don't understand yet.
Okay. Any questions from the floor? Okay, sorry.
Sure. This question is for Dr. Chiu. I wanted to know about iron deficiency anemia, if you've looked into that, and B12 anemia.
Yes, we have examined hemoglobin, although we do not have a lot of the more specific markers for iron, but iron intake was actually higher in vegetarian in this population, perhaps due to high iron vegetable consumption. Hemoglobin was a little bit lower, but both vegetarians and non-vegetarians, the prevalence of anemia was very low in terms of hemoglobin. Now, vegetarians have lower vitamin B12 and higher prevalence of vitamin B12 deficiency when we examine, but there were a lot of debates in terms of vitamin B12 deficiency cut points. So it depends on which cut point we use. I think vitamin B12 is still a problem in this population at the time because there's not a lot of use of supplements. Some of them do use supplements, but it's not as high as in Western populations. But it's changing, and I find that just by interacting with vegetarians, more and more of them know about the importance of supplements. Another potential possibility of which is that we don't really see a lot of over deficiency in terms of macrocytic anemia, and partially because of the high amount of fermented food and some of the sea vegetables that may potentially contain B12, although it's kind of controversial, but we recently published a study doing a dose response trial of nori and found that it was actually able to improve all the markers for vitamin B12 status. So I think for this population, it may be quite different, but I still think vitamin B12 is something we need to be very careful about.
This is Kenny from Hong Kong Polytechnic University. I have a question for Tina. So you have mentioned about the dietary assessment in both cohorts. I'm curious about the method for dietary assessment and how the status of vegetarian has been categorized. Because let's say if the dietary assessment has been done using FFQ, can we to categorize the subjects into more different types of vegetarian according to the avoidance of like milk, dairy products, seafood, etc., and maybe like a vegan diet, because the cohorts are unique in the sense that the prevalence or the proportion of vegetarian is relatively higher, so it may allow the opportunity to do further stratification onto the types of vegetarians. So we can take a look at this issue further, because like the plant-based diets that you have mentioned, maybe I'm just thinking maybe people are treating the plant-based diet like a continuum, a continuous score rather than a categories. So maybe a more contrast in terms of vegetarian that will allow us to differentiate who benefit more from this dietary pattern. So I would like to see what you think about that.
One at a time. We try to understand their diet through an FFQ, and there are different ways of using the FFQ. For vegetarianism, we identify in 2 stages. First of all, there is a question asking them whether they are vegetarian. And then we look into the detail of whether they reported any consumption of meat, fish, animal products in the FFQ. And because the population is mostly lacto-ovo vegetarian, there was less than 100 vegetarians. So for the prospective disease outcomes, we were not able to look into vegans specifically due to lack of power. However, for our collaboration with Oxford, because it's a pooling of many different studies, we did subcategorize into different vegetarians, including like vegan and just different types of vegetarians. But our paper is still under submission, so I haven't presented that part. So hopefully I will have more to share with everyone in the future. And another thing is, yes, we try to look into everything continuously as a plant-based score or the so-called healthy plant-based diet. But for several diseases, we also try to do that, not just insomnia, but we couldn't find a strong an association as strong as vegetarianism. And that is also one of the reasons I suspect it's not just vegetarian. It's because vegetarians may also have higher involvement in the community, more volunteer. So that is one problem that I think our cohort has. And so for the next stage, what I'm going to do is to collect data by linking to the volunteer work. And so we will be able to adjust for that. And at the same time, looking into how volunteerism might affect healthy aging. And so for the next stage, we are going to initiate another cohort within this group, hopefully, if everything goes successful. But for that part, we are going to measure other functional capacities that all of you mentioned about relevant to aging, but also try to link that data to their volunteer work to see if any specific types of volunteer work is associated with better preservation of functions. Our group had done some pilot studies showing that participating in recycling and community environmental protection projects led to some improvement in intrinsic capacities and cognitive improvement. So we are very interested, and perhaps we think that might be providing a solution in the future, incorporating this type of intervention. Not just they come in, we teach them stuff, but they should be the one contributing. If the elderly are given the mission, given the role, given the responsibility, then there's a possibility they know that they are important for the world. And having this ikigai, having this purpose in life, I think is essential to prevent decline in function.
Thank you very much.
Thank you.
Another question, Tina. So we understand that the vegetarian is effective for dementia, right? Preventive for dementia, mainly because of the low risk for diabetes and hypertension. I understand that. But how about the effect of vegetarian on Alzheimer's pathology?
I don't know, because we don't have enough sample to look into that. And again, I'm treating this dementia as something very preliminary because we didn't even have BMI for that population. And I feel we need to be more careful in interpreting that. And also because there are so many social factors that can be affecting dementia. It's a multifactorial disease. And so for the next stage of my cohort, we plan to do more, we plan to obtain more subject on the biomarkers to look into how each different nutrients or dietary components is the most important in contributing to the protection. I think we should be very careful with that result. So I'm just showing it as a preliminary result.
Okay. I might miss it in your talk, but what is the effect of vegetarian diet on sarcopenia and frailty?
So far, I don't have any data to speak about it. But in the pilot study that we, somebody from Tzu Chi, not me, conducted in the environmental protection group where the volunteers are doing recycling, they did see that compared with control, there's a better preservation for sarcopenia. And there's a, maybe because they are helping out, they are doing some physical activities while sorting doing all the recycling work. And it's not just that physical activity, because when they go and volunteer in the Center for Recycling, there's a lot of social interaction. They talk with people. Other volunteers are very kind and friendly. So there's a lot of social interactions as well. So I think it's not just one component, and definitely not diet alone.
How about the protein intake in vegetarian older people compared to
Right.
non-vegetarian older people?
Right. We assess that through FFQ, and although it's not perfect, it's slightly lower, but still, I think when I try to calculate per grams of body weight, it's more than 1 gram. So 1 gram per kilogram body weight. So I think for the majority are getting some protein from plant-based source. Dairy intake is very low, but some egg intake, but also some soy, a lot more soy intake.
I see. I have a question to Karen. So you showed the decline of whole grain intake in a detrimental group, because that is because of the poor oral function. Have you addressed that question in your cohort?
Deteriorating
And,
trajectory?
yeah, trajectory of deteriorating, and whole grain consumption decreased significantly.
That's a good question. We do have the data, but we did not take a detailed look. But I think we can take a more detailed look, and we also have sarcopenia data. Maybe we can have a second paper. I think that's a good question. So but usually in our study, we tend to adjust physical function in the model, like using IPAQ. And also we look at the different type of activity, for example, like social activity, cognitive activity, and also physical activity. Previously, we published a paper quite a long time ago. We found that these 3 types of physical activity, only physical activity can reduce the risk of Alzheimer's disease and the vascular dementia, but the other 2 cannot. But probably because our data is not so complete, we only ask about the frequency. Maybe volunteering activity has more social, interaction and more engagement with other people, and it can be more protective. I think this is a very interesting topic. And the other things about I think because the audience keep asking about diabetes. Interestingly, in our cohort, diabetes, the percentage is not very high, and throughout all my publication, we did not see significant effect. Pretty rare from people who have diabetes affect cognition. One speculation is that our participant may be too healthy. So this is also our goal. We are trying to aiming at the very early stage. So maybe that's why we did not see. But in a study in the later stage, they may be able to see the difference.
Thank you. Thank you.
Okay. And
I have a question for Dr. Chen. For your Tiger study, I see when you do in the factor analysis, you categorize traditional food.
Right.
For the traditional food, and including two diet pattern in there. One is a pickle, but in my opinion, that the traditional food in Chinese society should include a lot of carbohydrate, such as the rice, noodle, but I didn't see any of the carbohydrate content in the traditional category, traditional food.
Right.
Can you explain more?
Yeah, sure. Actually, we have 44 items, and sorry, did I bother you?
no problem, no problem.
Too close. We collapsed into 20 food groups, and among them, I believe there must be some like rice, these food. But after factor analysis, we only found we can group, based on the factor loading, the highest factor loading, we give the naming of the factory. It does not mean those people not eating rice. They still have, they still intake rice, but may not different across it's quite similar in the whole population. so it cannot stand out in a different pattern. So the reason we call it traditional because there's no other similar pattern in the world naming it. So we use traditional because we don't know how to name it. Right. So yes, rice, but rice in our study does not showing any significant association. It's not identified by the after we're using the factor analysis. So maybe in the future we can take a look at more about specific food items. Thank you very much. Thank you.
Okay, we still have some time. Any folks? Okay.
Yeah, I also have the question for the author of the Tiger Project, Dr. Chen, Professor Chen. Yeah, interesting. Is so honored that we could see the author of the Tiger Project right here, because normally we look at the project in the PDF file. Yeah.
Thank you.
The reason I'm asking is that it's interesting that in the project, you talk about the diversity of the vegetable or the nuts.
Right.
Probably would be the main, could be beneficial for the prevention for the dementia. Right. Yeah, but and I look at in the participant of the project, the economic situation of those participants, their annual disposable income is more than 33,000 every year. Yeah, the reason I'm asking that, of course, that if the people have the higher income, it would be possible that they could get the diversity of the vegetables. But for the lower income people, it seems not be possible. Right. Yeah. So have you considered about in the enrollment of the participant? Have you considered about the lower income people?
Right. Yeah. I think this is a very important question about study design. As I mentioned in one of my PPT, our study have high internal validity, but it's not easy to generalize to other population because we recruit our participants mainly from the metropolitan, Taipei metropolitan area. So their annual income is actually relatively high compared with other regions in Taiwan. So this is our limitation. So that's why I think we need more collaboration because the funding resources are relatively limited. So it's not easy to extend to all people around, even in Taipei. And we recruit these participants mainly from the senior health checkup program. After we recruiting them, we follow up them directly. So we are not sure why low-income people not coming to National Taiwan University for health checkup. So we need to figure out. Right, that's very important. Thank you for your suggestion. I really hope we can have more lower income participants in our study. Thank you.
This is a question again for Dr. Chen, so you might as well just come on back up to the front. It was really interesting to see the 3 diet patterns that you had, and they all were associated with some benefit to memory or, yeah. And so what explains that, do you think? I was surprised to see that the meat eaters, actually there was some benefit as well to that for some of the concepts of mental health. So what explains that? Is it the food frequency questionnaire that you used or what?
Yeah, I need to acknowledge one limitation of our research because we use a relatively simple FFQ, only 44 items. So we are unable to look at the nutrients. So we can only speculate. As I said, that the meat dietary pattern actually, because meat is rich in protein. So maybe that's why it's protective. I think it's protective against memory impairment. I cannot remember that well because I might have a cognitive impairment as well. And I think it's detrimental to verbal fluency. That's one speculation. The thing is that in the meat, it's rich in, red meat. Rich in saturated fat. That's our guess. But we're really hoping that like study like Tina's or other experts, they can do, because our FFQ is really short. So we are unable to figure out what specific nutrients actually lead to that result. But the strength of our study is that we have a very comprehensive assessment on cognitive function, so which will allow us to see different domains was differently affected by this dietary pattern. So that's our strengths and the limitations. So we are really hoping we can collaborate with other experts around here, in order to have more information. Thank you very much.
Thank you.
Right. Yes. Yes, has a very. Actually, one of our recent projects is about oral frailty. So I do believe that, and especially in Japan, that's a very advanced research, a very good research conducted in Japan. I do believe that it's not only the nutrition, it's about everything in the whole body. So we should take a look at not only the brain, not only the dental health, not only the gut microbiota, it's everything we should consider. We should put all the puzzle together to explain the individual's health. Thank you very much. Thank you.
Yeah. Okay, I think they raised a lot of questions and a very good mutual interaction. So I will thank our 4 presenters for your excellent speech and make a very good contribution and let us a very fruitful section this year. So come to the come to on the stage and I give a big applause for the 4 presenters. Okay.
And we would like to invite Professor Chiu, representing the NHRI, to express our gratitude. Group photos all together. Thank you. And distinguished guests, ladies and gentlemen, we have come to the end of our day 1 program, where we have listened to many insights from our speakers. Tomorrow promises more engaging sessions, and we look forward to welcoming you back for another enriching day. Thank you all. Enjoy your evening, and see you tomorrow. And for those who have collected a receiver device, please remember to return it to the registration desk.